Obesity is rising dramatically. In India, where we live, these obesity statistics are actually underestimates.
A ticking time bomb. That is how experts described the obesity epidemic in India. In 2022, 1 in 8 people in the world were living with obesity. At least 44 million women and 26 million men in India above the age of 20 years are clinically obese. These research findings by Lancet, published earlier this year, proved to be a landmark study which zoomed into India and put the spotlight on the rising risk of obesity and non-communicable diseases in the country. Globally, the WHO says that obesity is responsible for 44% cases of diabetes, 23% cases of heart disease, and 7 to 41% of all the cancer cases. A few years ago, a Niti Aayog doctor had also said that obesity was a silent epidemic in the country. But what does all this data mean for you? Is obesity really a crisis in India? We are here at Sitaram Bharti Institute of Science and Research to speak to Dr. H.P.S. Sachdev, who was one of the contributors to the Lancet study on obesity.
Obesity is associated dramatically with the risk of non-communicable diseases like diabetes, hypertension, hyperlipidemia, cancers. So it has health consequences and needs to be dealt with. More than 50% of the children had metabolic markers which are associated with obesity. Overnutrition or obesity is increasing. I think that is the crisis which needs a very serious attention now. Once you get diabetes, once you get hypertension, these are lifelong diseases. Stroke, cancer, and the cost that it causes. So we must act on an emergency or a semi-emergency basis.
The question also arises about what India has been doing so far to control obesity in the population. Union government programs like the National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Diseases and Stroke, and the National Monitoring Framework and Action Plan for Prevention and Control of Non-Communicable Diseases have identified obesity as an area of intervention. The centre also runs programs such as Fit India to promote a healthy lifestyle with more physical activities. Schools affiliated with the CBSE have often been directed by the board to not allow junk food in the premises. The Food Safety and Standards Authority of India mandates that nutritional information of all processed foods be displayed on the packaging. But is that enough?
The responsibility for reducing this depends both on the society and the individual. Excess sugar can cause a problem, excess fats, blood pressure can be raised if you have excess amount of salt. So these need to be regulated and a health education awareness has to be done. Physical activity has to be increased in one way or the other. But the government has a role in, like sin tax can be put for sugar sweetened beverages or things, and warning labels on this like you have for the smoking can come up to the ultra processed foods.
There are other policy measures that can be brought about too. Train healthcare professionals to recognize early symptoms, personalize support and create incentives for obese individuals to opt for healthier lifestyles. Decrease the taxes on organic food, and most importantly, create a system where people are periodically screened for obesity.